Hey guys, what is up? It is Adventure, and welcome back to some more surgery games. This one looks like it's gonna hurt already. It's the open carpal tunnel release. Oh, by the way, this is my on-screen keyboard because I don't have batteries for my keyboard because people that live with me.
Welcome to Surgery Squad's virtual limited open carpal tunnel release surgery. I'm Dr. Jeff, and I will be guiding you through the procedure today. Carpal tunnel syndrome is characterized by a tingling numbness or pain in your hand, and sometimes forearm. It develops due to the swelling of a ligament in the wrist known as the transverse carpal ligament. The swelling of the transverse carpal ligament creates pressure on the median nerve in your wrist. This nerve is responsible for supplying feeling and movement to various parts of the hand. Performing repetitive motions with the hand or wrist over a long period is the main cause of carpal tunnel syndrome, and the condition is more commonly seen in women than men. Researchers have also discovered that other medical problems such as alcoholism, arthritis, diabetes, obesity, and infections could also lead to carpal tunnel syndrome. Today we'll be operating on a patient who has been diagnosed with carpal tunnel syndrome after experiencing numbness and weakness in the palm of his hand and thumb. Now let's put on our gloves and get started.
Yeah.
The limited open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist. If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic. Go ahead and get the operating area numb.
Oh, God. No, blood. Okay, prepare to be emo.
With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be making our incision?
Can I please just draw a penis? Oh my gosh! Best game ever! Yeah! Okay, I'm sorry. How's that, Doc?
Looks good to me.
Man.
We'll be making a 3/4 inch incision at the intersection of those lines. Now take the scalpel and make the incision.
Oh my gosh!
Nice! I couldn't have done it better myself.
It's not nice!
Now let's spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open. I think you're a natural at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place.
Oh my
God! You'll run a special knife down the guide to split the carpal ligament. As you push the knife forward, you will feel it cutting through the carpal ligament.
No! Oh my gosh!
Perfect. With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision.
That is not healthy.
Go ahead and irrigate the wound. When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand.
Okay, it's just water.
Great. Now you'll close the wound using non-absorbable sutures.
Thank God, finally.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Totally not heroin. I stabbed him twice. I broke it. I seriously broke it. Alright, yeah, let's go to step 7 because I broke it.
With a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover. Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist. Once our patient returns home, he'll be asked to follow specific instructions for driving, exercise, and medication. This will include keeping his hand elevated above his heart for the first few days after surgery. About 2 weeks after surgery, we'll remove our patient's stitches, and he'll be gradually allowed to return to his normal routines in 4 to 6 weeks. And that's a limited open carpal tunnel release surgery. Thanks for stopping by. Why not try out some of the other amazing surgeries here on SurgerySquad.com?
Okay, I'll try and find one, and yeah, I guess I'll see you whenever we find a I kind of forgot to do it, but this is LASIK eye surgery. Now our eye is going to be feeling some pain. God, I wonder how I'm going to make this thumbnail.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses.
I don't have
LASIK
time.
eye surgery reshapes the cornea to provide improved. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
Oh, wait, I think we only
Even
just
with
do
the
one
numbing
eye.
drops,
I don't know.
it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain.
Wait, why is
Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide. So let's get that speculum over the eye.
I would not do
good. If the patient was allowed to blink,
I would blink.
We might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye. The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached.
I actually may have to cut
For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a unique device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the top to create a thin flap in the cornea.
That is not right.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea. This is the part we'll reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing the patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser, and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound, and you might notice a faint smell similar of burning hair. And that's it. Please fold the corneal flap back into the original position. Nicely done. While you were working, I went ahead and took care of the other eye.
Hurry up!
We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes.
Can we make that just clear?
The patient will notice the improved vision immediately.
Hang on, I got this. EPSPTOZLE LPEDPECL